If you ever thought to yourself, I know my child needs support, but I'm not sure where to start, or if you've ever left an appointment thinking, I didn't say everything I wanted to say, then this video is for you. Hi, welcome to another episode of Beyond the Eyes, Understanding CVI, where we provide valuable information for parents, caregivers, and educators. In our last episode, we talked about the most common interventions used to support your child. In this episode, we'll talk about how parents can confidently advocate for healthcare services, walk through available resources and school accommodations, and lastly, how to navigate systems that are meant to support your child. Let's get started. Advocacy is not about arguing or demanding healthcare services, and it's not about confrontation either. It's about communication. It's about sharing information, asking questions, and making sure your child's needs are clearly understood. You don't need to know all the medical terms, and you don't need to say everything perfectly. You just need to speak on what you see every day. You are the one who sees your child at home, at school, and throughout the community. That perspective matters. You can advocate by sharing how your child functions at home, describing what helps or hinders visual success, and asking for consistent strategies across home, school, and therapy settings. As we've stated before, CVI is a brain-based visual condition, and it doesn't always show up on standard eye exams. This means children may be told their vision is fine, even though daily activities remain difficult. Even more importantly, many of these children are nonverbal, so advocating for their needs becomes even more crucial. When CVI is misunderstood, children might not receive the right evaluations, therapies, or support. Advocacy helps ensure that care focuses on function and participation and not just test results. The healthcare system can feel overwhelming, with multiple appointments, referrals, paperwork, and different providers. It's okay if you don't understand everything right away. One helpful strategy is to think in terms of function. What activities are hard for my child? What support would make those activities easier? Who on the care team can help with that? Keeping the focus on daily life can help guide conversations in a meaningful direction. Preparation can make advocacy feel less stressful. Before an appointment, try to write down 2 to 3 main concerns. Note examples from daily routine. Bring reports or notes from school or therapy. As an example, my child avoids busy spaces and becomes tired quickly when there is a lot to look at. These examples paint a clearer picture than test scores alone. Sometimes, despite your best efforts, you may feel dismissed. That does not mean you're wrong. It's okay to ask for a second opinion, request referrals, or even bring another provider into the conversation. You are allowed to seek answers that make sense for your child. Advocacy works best when it's collaborative. Encourage communication between healthcare providers, therapists, and educators. Ask how information is shared and how goals align across settings. When teams work together, children receive more consistent and effective support. Now, let's get into some helpful resources. Like we mentioned in the last video, children with CVI may receive support from a variety of professionals, including early interventionists, occupational therapists, physical therapists, speech-language pathologists, teachers and special educators, orientation and mobility specialists, eye care and medical providers, and neurologists and geneticists. Here are 2 helpful organizations found in South Carolina. The first one is the Association for the Blind and Visually Impaired, or the ABVI. This organization provides early intervention resources that focus on family training, as well as lending libraries that have books from the American Printing House for the Blind, as well as other organizations that specialize in educational materials for early intervention and school-age populations. The second organization is the South Carolina School for the Deaf and Blind, which provides some resources and aids for children with CVI. Some of these resources include the following: fully accessible print and electronic materials, instruction in the expanded core curriculum for blind and visually impaired students, including necessary supports and compensatory access, sensory efficiency, assistive technology, orientation and mobility, independence, social skills, recreation and leisure skills, career education, and self-determination. Staff includes teachers, psychologists, therapists, related service providers, administrators, and others involved in education who understand the unique nature of visual impairment. Students also have the opportunity to be exposed to blind or visually impaired role models and are able to interact with a large number of like peers. School is one of the most important environments for children with CVI. Children with CVI may qualify for supports through the Individuals with Disabilities Education Act, or IDEA, which is a federal law that makes sure children with disabilities receive services. Another support is the Individualized Education Program, or IEP, which is a legally binding plan for students with disabilities that need specialized services and instructions to progress in school. The 504 plan removes barriers in order to ensure equal access to school environments and opposed to the school curriculum for children with disabilities. Lastly, children with CVI may receive support through vision services or related therapies. This chart compares and contrasts the 504 plan versus an IEP. As you can see, the 504 plan is used for any disability and provides accommodations to the child's environment and not the curriculum. The IEP, on the other hand, is used for one or more of the 13 disabilities listed in IDEA and provides accommodations to the environment and may include modifications to the curriculum. They both, however, are legal documents, level the educational playing field, and are of no cost to the parents. If your child is under the age of 3, parents, doctors, or caregivers can refer your child to South Carolina's Early Intervention Program if they have any concerns. A service coordinator is then assigned to help guide the family through the process. After this, professionals will evaluate the child by looking at 5 main areas: cognition, physical, communication, social-emotional, and adaptive development. The family's resources, priorities, and concerns are also assessed. The team will determine if your child has a qualifying developmental delay or disability. If eligible, an IFSP, or Individualized Family Service Plan, is developed and outlines specific goals and services, like therapy, and locations for delivery. Services are provided in natural environments like home or childcare settings. Before your child turns 3, a plan is created to transition them out of early intervention into other services like preschool. If your child is 3 years old or older, the process is relatively the same. Your child is referred for evaluation by parents or school staff due to suspected developmental delays or disabilities. The district will then conduct a comprehensive assessment in all areas of concern. The IEP team will then review evaluation results to determine if your child qualifies for special education services. If eligible, a team meeting will create the IEP, which includes current performance levels, measurable SMART goals, and required services. Parents must provide written consent for the initiation of services. Once provided, services within the IEP are reviewed annually. We've already mentioned common CVI-friendly accommodations in the last video, but let's touch on them again. These supports are individualized, but may include reduced visual clutter in workspaces, preferential seating based on visual field needs, high contrast or simplified materials, extra time for assignments and tests, verbal descriptions of visual information, and modified worksheets or digital access to materials. These accommodations help to remove barriers and allow for greater success in school environments. Many parents find it helpful to keep a resource folder or binder that includes evaluation reports, therapy recommendations, accommodation lists, contact information for providers, and notes on what strategies work best. This helps you feel more prepared and ensures your child's needs are clearly communicated across multiple settings. All right, in our next episode, we'll talk about the importance of coordinated care and how teamwork across settings can help support your child's success. Thank you so much for being here. If you found this video helpful, please like, share, and subscribe for more content on navigating life with children with CVI. Together, we can make the world a more inclusive and supportive place where all children can thrive. See you in the next episode.